You woke up. It's almost saddening to see you wake up. You were sleeping like a baby, which is wonderful. Given look right out of the gate here, I'm sensing good news because I was brought here by your loved ones who have told me about a condition that you have. I'm somewhat of an expert in this condition, largely because of the, it's a sort of pejorative tenet, but I took it to heart in medical school, and I still take it to heart, which is Dr. Heal Thyself. And I have suffered from the same malady that you have. And I'd like to think that I've overcome it. Now, your malady, whether you choose to admit it or not, you have to acknowledge that there are people who are well-versed in certain areas and are experts in those areas, and sometimes, not all the time, because sometimes everybody's just winging it, right? But sometimes you have to take people at their word and take what they're saying at face value and trust. Put your trust in the fact that they may know more about the subject than you do. And from your background, from what I've heard from your loved ones, there's probably very few areas of study where I am more versed than you. However, in this particular area, I think you have to give me the edge because I've experienced it, and as a direct result of my experience, I have gone to school in an attempt to overcome it, and I believe that I have overcome it. And I'd like to take this time that we have. I do have other appointments. I'm not generally one who makes house calls, but this was a favor that was, I don't want to say cashed in, but this was a favor that I'm doing for your closest friends. And I must admit, in some part, I'm fascinated by your case, largely because of the parallels with my own. So, the first step, and like I said, a lot of medicine is taking notes, and assiduous notes would be for me to get a comprehensive list of your symptoms. So if you don't mind, just go ahead. You can start anywhere. You don't have to start with the most dire or the most innocuous. You can, whatever, you could go. A good way to do it, head to toe. That's a good way to do it. So just give me what you got here, and we'll get started. Okay. Headache. Yes, headaches are, they're a bane. They make it difficult. It's sort of it's the lowest level. This is your brain that's being affected. How can you do anything else when you're suffering in the throes of a bad headache? So you get headaches. How often do you get headaches? Yeah, weekly. It's not particularly unusual. Are they concentrated anywhere? Some behind your eyes. Also not unusual. Typically, that can mean that they're sinus related. It doesn't always mean that, but that can be one possible reason. Do they come and go quickly? Do they have a rapid onset? We'll see now. Yeah, those we call Icepick headaches. Not quite as usual to have those behind the eyes, but certainly possible. And how long do they last on average? Oh, that's horrible. 4 to 6 hours. I mean, that's practically, that's your whole day, right? Because even once you overcome and once you feel better, you must be exhausted. And that's terrible. Okay, so headaches. Do you notice that these headaches come at particular times or under particular circumstances? When it's storming, when you've been out in the bright sunlight, when you've been staring at a computer screen for a particularly long amount of time, anything like that, reading even. No? Had your eyes checked? You've been to an ophthalmologist and or an optometrist in the past year? No. Nobody does. It's it would be good if people were more assiduous about visiting their eye doctor, because the eyes, they say the eyes are the windows to the soul. The eyes are also, in many ways, the windows to disease. And it can be very important. And there's a lot of early indicators for a lot of diseases that can be detected by a simple visit to the optometrist. So I'm probably going to do some eye work, let's just call it, while I'm here. Okay. But you can't trace your headaches to a particular activity that you engage in. It's fine. What's next? Earaches. Often, and I'm not saying this is the case, but what you're describing, and what you're starting to describe, what I'm starting to hear, is a lot of these symptoms will come as a suite of symptoms. Often an earache can spark a headache. And that's not unusual or not at all. Do you get them simultaneously often? Have you noticed? No? Usually separate. Okay. Okay, well, if these were the result of, and now I'm not saying, these are the result of something, right? There's something that's causing these, whether it's psychological or physiological. Something is causing these symptoms. But generally, if it's physiological, you'll have, especially like I said, in these sort of suite-based symptoms, a common cause. And they will often occur, not concurrently, but in parallel. Sore throat. And this is in the absence of like a typical flu kind of setting. This is just a sore throat with no other symptoms accompanying it. A couple times a month. And it resolves spontaneously. It just kind of goes away. Yeah. Okay. What else? Neck pain. Is that on one side, both sides? Both sides of your neck? But, one side at a time, but you get them on both sides? They typically start at the base of the skull, go down like behind the ear, yeah. Pardon me one moment here. Let me just get out my... There's, I realize there are better ways to keep notes than in an old-fashioned notebook like this. Certainly more effective ways to look things up and to keep things updated, but there's something to me about the act of transcribing that really sort of helps get the idea into my head in a way. I mean manually transcribing, not via a keyboard. But I do have lots in this, a lot in here. Sort of the majority of my time in medical school spent taking these notes. Whipple's disease. It's not what you have. Okay. Okay. So the pain in your neck, sore throat, pain in your neck. Again, I'll rely on you if there are symptoms that you're describing to me that are concurrent. Please let me know. Otherwise, I'm going to assume that they are not. And how does this pain in your neck? How does it manifest? Is it a shooting pain? Does it radiate anywhere into your shoulders, into your chest, up into your head? Does it become a headache? Precursor to a headache? No. None of those. All right, that's good. Well, I'm sorry. Yeah. So sweats. You break out in sweats on your face. Okay. Headache, earache, sore throat, neck pain, sweats. No concurrency. Okay. Yeah, let's keep going. Before I examine you, might as well get all of this out of the way, if we can. When you breathe, you sometimes feel discomfort when you breathe, like when you inhale very deeply, or sometimes gastritis, could just be lung infection of some kind. Pain. Well, you are dealing with a lot of things. Yeah. Pressure in your chest. And when does that manifest itself? When can you associate any events or any times when you're more likely to feel this pressure in your chest? Okay. Sometimes at night, yeah. Okay. Palpitations, okay. How about that? Any associated activity? No, not exercise, not... You get them when you're lying down. Picking things up, yeah. This is often attributed to the vagus nerve. It can hyperexcite the nodes of the heart, sometimes cause an escape beat to escape. Okay, and how often do you feel those? Daily? Several times a day? Okay. There was a study when I did my cardiology rotation where they put Holter monitors which record every beat of an intern's heart for 24 hours. And none of the interns in my class, excuse me for a second, just kind of readjust myself here. None of the interns in my class reported any sort of feelings of fluttering or palpitations. However, 25% of them had recorded escape beats, some bigeminy, even some NSVT. So it's not uncommon. It can be a scary thing, but not uncommon. I have to go to another page. And we're only about this far down. Okay, what's next? Tingling in the arms. Is that both arms, one arm? It happens to both arms, but one at a time. When you feel these tingles, do they originate and radiate? Or are they just your entire arm? Do they tend to concentrate nearer to the distal portion of your arm, near to your hands? Okay. And the frequency on that? Hard to track. Once a week, once every 2 weeks, a couple times a month. Okay. That's fine. Numbness in the thumb. Your left thumb. A feeling of disassociation in your left thumb. As if your thumb is not a part of you. Am I interpreting that correctly? Okay. And the frequency on that. Okay, daily. How long does that last? Are you dealing with that all day, every day? Because that would be, that would just be torture. No. Yeah. I mean, I want to reassure you. Nothing that you've described to me so far is, in and of itself, any real cause for concern. You definitely are suffering from a lot of things, a lot of symptoms. A lot of these, tend to go together. They tend to go hand in hand, and they certainly can be psychological in origin. Okay. Keep going. Stomach cramps. Yeah. Is this after you eat? after you eat? What's your diet like? Mm-hmm. I've heard worse. Mm. And would this be immediately after you eat, or after you've eaten, or is there a period of time that passes? So you will wake up sometimes in the middle of the night with cramps. It's terrible. So that's more of an intestinal pain, not a stomach pain. But you're saying, you get both. Okay. What else? Heartburn? You get heartburn? Just a burning kind of going up your throat? Yeah. Is that also tied to eating, sleeping? Have you taken over-the-counter medications for that? Alka-Seltzer, Tums, any kind of base to sort of reduce the acid in your stomach? Milk? You're better off with something with a kind of calcium rich supplement there. But shooting pains, your back, going up your back, your entire back, the spinal area, yeah. Also, okay, a kind of to the left and right side of your lower back. Yeah, kidneys, most likely. Okay, what else? Difficulty going to the bathroom. We're talking about moving your bowels, I assume. Yeah. Is this a constipation kind of feeling? A couple of times a week, okay. Is there ever any blood in the stool? There's blood in the stool? Okay. Is that frequent? Well, that can be surface irritation or intestinal issues. There's a lot of things. Okay. How about your legs? Are your legs pretty good? No? Knees? And what about the knees? When you're walking, sharp pain, like on impact, sort of an impact pain. Makes it difficult for you to get around. Okay. Can I assume your calves, shins, those are okay? Nothing wrong there? Welts? You have welts all along the shins? The front sort of splint? Okay. And those have been persistent for years. Okay. Have another page. Okay. So, okay, your feet, yeah. Bunions, yeah. I'm sorry, spastic feet? Spastic feet? Is that what you're saying? Can you describe that to me? I'm just not 100% familiar with that term. Like, oh, restless legs, sort of. Okay. Curling toes. And these are, they curl involuntarily? They sort of spasmodically curl. Is that what you're saying? Okay. And is that something that happens all the time? Is that... Okay, well, we've gone through quite a few. This is a good list. I can't say that I myself have ever had suffered from a list quite this extensive. However, that doesn't mean much. There certainly be. Yes, of course, psychological panic, anxiety, depression. Yeah. You haven't seen a psychiatrist for any of this, or a psychologist? Well, yes, I am, but psychologist. I'm trying to establish your history, that's all. Okay. Do you ever think about hurting yourself or others? No? Does your anxiety prevent you from doing things, going places? Yes. Do you find that when you get somewhere that you're dreading, that you tend to adjust better than you think you would have, or no? You just want to leave as soon as you can, right? Well, if it's a boring get-together, I can understand that. No, not boring? Just don't ever want to. Okay. Existential dread. Okay. But you never think of harming yourself. No, okay, yeah, So, I can't imagine that this must directly and adversely affect your sleep. Yeah. How many hours of sleep do you get a night? That's not tenable. That amount of sleep deprivation over time, and sleep deprivation carries, to a very large extent, it carries. So, you're essentially building a deficit as you go through life, missing more and more sleep. Nightmares. Yeah. Night terrors. So you wake up and you can't, sleep paralysis, you wake up and you feel like you cannot move. Does this accompany often, do you find that this will accompany, for instance, pressure in your chest or any of these other symptoms that we've talked about? No, just fear. Maybe sweating, okay. That makes sense. You, my friend, you are beleaguered by these terrible, terrible symptoms. It is a cornucopia of symptoms. You're almost making every check mark in the book. Now this sounds, on the surface of it, it sounds bad. But I'm pretty confident that all of these things, first of all, a lot of these things I believe are linked in their cause. And I also believe almost every one of them is psychological, manifesting in a physiological way, but psychological in origin, and therefore treatable via a psychological method. But I would like to do some diagnostic tests on you, just to be sure. We need to cover our bases. This was a lot, and I don't want to... voices, you hear voices. No, we need you to be thorough. Any of these things could point towards some sort of commonality, some kind of linking bond that might make a diagnosis that encompasses all of these things. So it's important that all of this stuff... Wetting your bed? Right. No, I understand why you might have held that back. Okay. And is that nightly? Nightly. How long has that been going on? Okay. That must be difficult to deal with. You're getting a little enough sleep as it is if you get woken up from a nightly emission. That is just another interruption that you don't need. So I'm going to go through these real quick. Headache, earache, sore throat, neck pain, sweats, gosh, my handwriting here, pain when breathing, pressure in the chest, palpitations, tingling in the arm, down both arms, distal tingles in the hands, fingers, a sort of dissociation with your left thumb, stomach cramps, you're woken up by stomach cramps, blood in the stool, pain in the spine, pain in the kidney area, constipation, a throbbing and impact triggered pain in your knees, sharp pain which radiates when walking, welts along your legs, restless legs, spastic legs as you call them, restless legs, curling toes, panic, anxiety, depression, existential angst, fear of death, night terrors, sleep paralysis. It's often tied to night sweats, which of course makes sense. Pardon me. Voices in your head. Wetting the bed. Is that pretty much everything? Okay. All right. Well, it's a start, and now I think we need to jump right to the diagnostic portion of our appointment, and see if we can get to the bottom of this. What do you think? What? Sorry. That's important also. So flatulence, okay. Frequency, every few hours. Okay. Before you remember anything else, let's go ahead and get started on the diagnoses, or the diagnostic tests. So I'm just going to start with checking your heart, taking your blood pressure, a few other things. I prefer the old school when it comes to the art of diagnosis. I like to palpate with my hands. I like to hear the sound in the thorax and the chest when I'm tapping to see if there's any sort of buildup in the lungs. I don't like to leave any of this to machines if possible. The machines certainly have their place and can do wonderful things, but it's just not my way. Okay. So I'm just going to start by listening to your heart. I have to lean over here. You take a deep breath for me. And again. And again. One more time. All right, just breathe regularly, please. Okay. Now I'm just going to apply some pressure to your abdomen, and I just want you to tell me if you feel any pain at any of the places where I apply pressure. Okay. How about there? Okay. Nothing? Just usual. I realize it's slightly uncomfortable, so... but beyond that discomfort, it would be pain. It would be quite recognizable as pain. Okay. Right now I'm going to take your blood pressure, and we'll move on from there. If you could just give me your right arm, please. Typically it's left, but it's fine. Just relax, breathe normally. know it's uncomfortable, sorry. Okay. Quite normal, quite normal. Nothing unusual there. Okay. Now I'm going to have a look in your eyes, your ears, your nose, and your throat. Start with your eyes. Sometimes this thing is really difficult to get into place. You'd think they would have perfected this by now. There we go. Alright, so if you could just follow the light, that would be great. Try not to blink. Just down a little bit. Let's go there. Just try to see what your pupils are doing. There's no ptosis of the eyelids, pupil responses. Pupil response is good. Okay. I'm going to have a look in your ears. Oddly, it may not look like I'm looking in your ears, but I assure you, I am. No inflammation, no sign of trauma. You're not jamming paper clips in your ear or anything like that. Quite normal. And now your eyes one more time. Sorry. Very interesting. You definitely present a unique case. Now, my next couple of tests involve doing a little bit of lab work. I have a portable lab in my station wagon that I bring with me so that I don't have to send any of my blood work off. I can do it all right here. Now, I know that blood work and the thought of giving blood is highly anxiety inducing. So what I'm going to do is do a few things to sort of mitigate against that. Introduce you to a few techniques that I've used in the past to help calm and relax patients so that when the time comes for the needle, they're quite prepared. And this may seem a little unorthodox, so please bear with me. I find that Mystic Dragon Tea is an excellent way to relax. And no, I don't mean drinking it. I mean listening to it. I don't know what it is about it, to be honest with you. I remember when I was a child, I used to have a security blanket. And I would take that security blanket and jam it admittedly, I'm making some assumptions about you based on your laundry list of symptoms. That also fear of needles not be totally unwarranted for me to make the leap that you might have a fear of needles. So hopefully you're not insulted by that. Now you might be saying, Dr. Prince, if you're going to put on sterile gloves and then rub your beard with them, what was the point of putting them on in the first place? And the answer is, of course, my beard is sterile. Just like me. I don't want you to be alarmed. The needle looks a lot bigger and more intimidating than it actually is. And I think you'll find that you'll barely feel anything but a slight pinch. But I do have to draw some blood in order to conduct these tests. Like I said, I'm firmly convinced that there's nothing wrong with you, that some psychiatric medication can't fix, but we have to cover our bases. Okay, now I promise this won't hurt, okay? I'm very good at this. Let's apply some pressure there. That'll be fine. That should be more than enough. to run the tests that I need to test. So I want you to just lie here and relax for a bit. I'm going to go run these tests, and when I come back, we can finish up, okay? You fell asleep on me. That's just fine. I was gone for a little while. I actually needed to come back and take more blood from you, but you were passed out. You didn't even know it. So that worked out well. So I've been going over these results, and I spoke with some other members of the household as well. And the first thing I want you to do is just relax and don't worry, because everything is fine. But I would like to go over these results with you, sort of one by one. So, in analyzing your headache, you had markers for glioblastoma, which is a very aggressive form of brain cancer. Very difficult to treat, very hard to operate on, in fact, inoperable in most cases. So I was wrong there. Your earaches actually came from a chronic cochlear infection from an amoeba that is only rarely ever found in Amazonian rivers, called the vermicelli. Vermicelli, I think is the way it's pronounced, vermicelli. And what those tend to do is burrow towards the brain, and the prognosis for that is really not very good. The sore throat was caused by another kind of parasite, which is a longus tuberculum. So the longus tuberculum is actually a parasite that is native to Canada. So I don't know if you've been traveling, but somehow you picked up both of these parasites, and that's very bad. That parasite is also was one of the parasites that was found when people were using neti pots, and basically there was an amoeba that was burrowing into their brain and causing infection and death. Your pain while breathing. So we were also surprised, and when I say we, I mean me. I was also surprised to find evidence of an aggressive tumor in your lungs, which I believe must have partially spread from some of these other issues, which I'm about to go over. Your palpitations are caused by an electronic short circuit, which can cause fatal arrhythmias, combined with, you seem to have long QT syndrome and some reentrant tachycardia that can lead to ventricular arrhythmias and death. The tingling in the arms, this was caused by, I can tell from the C-reactive protein, you must have had some minor heart attacks, which were caused by sort of sclerotic arteries, and you have very advanced arterial sclerosis. which has a very, very sobering mortality rate. The distal tingles, these are the result of sort of a nerve disease, a degenerative nerve disease, that some people think is similar to ALS or similar types of nerve diseases, but it actually is so rare it has not been named yet. However, it does have a sort of similar progression. Eventually you lose the ability to breathe on your own. Your stomach cramps, so you had some torsion, and it's very new sort of science how I can tell that you have torsion from blood work, but there are markers for it. So you have intestinal torsion, which would generally mean that we would need to resect and cut out large pieces of your small intestine in order to get things functioning properly again. The pain in your spine that is caused by advanced degenerative vertebral disease. Basically, the discs between your vertebrae have eroded away, and the bones of your spine are now just kind of rubbing up against each other in a most unpleasant way that is generally considered irreversible and leads to a sort of crooking of the back and the inability to walk. The constipation. Now, you might think that would be caused by the torsion in the small intestine, but that is actually caused by a growth, some sort of mass in your large intestine, which is backing up. And as you know, it's caused many, many lethal incidences among even celebrities. It's not a good thing, and that is what is causing the blood in your stool. The pain in your knees, that is essentially a function of your immune system attacking the joints in your knees. It's a form of arthritis, and it tends to start in the lower extremities, move its way up, and soon it becomes very difficult to move at all without there being intense pain. The welts on your legs, those were also parasitical in nature. Let's just say those welts are made up of living creatures. Not go too far, much more into that. So the spastic feet, that is a result of the sort of incipient nerve damage from the earlier issues we were discussing. And the curling toes, well, that's generally caused by a shortening of the tendons, and what basically happens is the tendons are atrophying and sort of dehydrating and shrinking such that you can no longer straighten out your toes and soon your hands as well, and that's going to be extremely painful. Your panic, your anxiety, and your depression, all most likely caused by your body's knowledge. Your body kind of knows what's going on, and so it has cause to be depressed and anxious and to devolve into episodes of panic because it can sense its own demise in a way. Likewise with the existential angst, the night terrors, and the sleep paralysis. Those are most likely the result of the decaying gray matter in the frontal lobes as a result of the glioblastomas. Now, the voices in your head, I'm not really sure. Is that the parasites living in the cochlea? Is that the result of the glioblastoma? Tough to say. It's a tough call, that one. It could be either one. Could be both. If you've noticed that you're getting two distinct sort of sets of voices, maybe saying different things, perhaps they're coming from different sources. And of course, wetting your bed. I'm guessing that that's coming from the mass in your large intestine, which to me, that mass seems to only possibly could have been caused by some sort of radiation exposure. So I'm not sure if you've been near any sort of nuclear power plants or been driving on the road where there have been any leaks of hazardous waste, or if you live in a very old house. There's a lot of reasons why. This is a very old house. It's very possible. I probably don't want to spend too much time here if that's the case. So, all in all, on the surface of it, sounds like horrible news. There's a bit of a light at the end of the tunnel. If you notice, I'm switching pens here, and I am bringing out the red ink, and with good reason, because as I mentioned, while you were asleep, I took more blood from you and ran more extensive tests. Now, the glioblastoma, one of the experimental treatments for that is to release a parasite that burrows into the brain that has a preference for cancerous tissue. And it just so happens that the vermicelli, which is the cause of your earaches, are such a parasite. And in fact, it does appear that they have been slowly but surely destroying the cancerous cells in your brain. You still have some degenerative issues going on there, and that will be going on for a while. But I'm hoping that resolves that. The sore throat, the parasites in your sore throat, let's put a little asterisk by those for now. The neck pains, now that's actually, I don't have that tied in with anything here. Those are most likely secondary symptoms to the larger issues you have going on. Your pain when breathing comes from, of course, we mentioned the mass that we found in your lungs. However, that mass, when I cross-referenced it with the signature, the DNA signature of the mass that was in your large intestine, they matched completely, which means that you probably got them from the same radiation source. And I'll tell you why that's good news in a few moments, but let's move on here. The palpitations caused by the errant electrical pathway in your heart. Combined with the tingles in your arms. Now, the tingles in your arms were thought to have been caused by arteriosclerotic veins in and around your heart, arteries in and around your heart. The electrical short circuit in your heart was causing it to beat at a much faster rhythm than normal at times. That essentially cleared a lot of that sclerotic material out of there and may have been the cause of some of the pain in your neck in the form of small transient ischemic attacks. But the fact that you are here talking to me and seem fairly cognizant means that these didn't really cause any problems. So it's very possible that the errant pathways in your heart acted as sort of a liquid plumber for the sclerotic material in your arteries, clearing them out. And in fact, I went and double-checked that, and that does seem to be the case. The tingles in your distal arms, that actually just comes from the same thing as your upper arms. The left thumb will come back to that. Let me make a note here to come back to that. The stomach cramps after eating. Now, that is caused by torsion, as I mentioned. However, down here, the pain in your spine caused by the degenerative disc disease means that your spine was kind of leaning forward and kind of starting to curl you forward, which in turn gave your intestines the space they needed to untwist themselves. And again, I have verified that, and that is in fact what happened. So the pain, the cramping, similar thing. So the pain in your spine caused by the degenerative disc disease, that excuse me, I have to find this here. I wish my handwriting were better. Well, let's put a star by that one too. But the blood in your stool, that's actually a direct result of the parasites that had sort of traversed through the blood-brain barrier and gotten their way into your stomach. And these particular parasites have a hankering for the types of masses that you have blocking your large intestine. And when they devour that material, there's going to be some blood in your stool. So really that is a sign in this case of healing. The pain in your knees from walking, these sort of degenerative autoimmune dysfunction that's going on there is also kind of the result of a cancer. However, the radioactivity that you were exposed to, I don't know where you were exposed to it from, seems to have done a good deal to take care of that and essentially give you an intense, if unintended, round of radiation, which has nullified the progression of that particular portion of your disease. The spastic feet and curling toes. Now, that is caused by the dehydration of your tendons. Now, why aren't they getting hydrated? It's a very good question. It is because the very bacteria and living creatures that typically create the ecosystem that allows your tendons to be lubricated, for lack of a better word, had been congregating in the welts in your shins, largely because they were afraid of all the other crazy stuff going on in your body. However, while you were out, I was able to take this reflex hammer and just gently sort of disperse those bacteria back into your bloodstream. So hopefully they will rehydrate those tendons, and that will take care of that. Now, as you can see, almost everything on my list has been crossed out by some crazy occurrence of happenstance and coincidence, where you happen to have developed diseases that for some reason hated other diseases and went to war in your body. Your body was like Stalingrad. Your body was like Gallipoli. It was like Verdun. It was a battleground, and it still is a battleground. There's still a battle going on there between the evil diseases and the other evil diseases. But you benefit from it, which is great, because those things will resolve in time. I hope your panic, your anxiety, and your depression, and your existential angst. And of course, all of these things will take care of your night terrors, sleep paralysis, the voices in your head, and the wetting of the bed. So that is all just fantastic news, and I'm really pleased to be able to report it to you. However, it would be remiss for me not to mention the one outstanding symptom you have, which is the numbness and the feeling of disassociation in your left thumb. This is very serious. There are experimental treatments that we can look into. I'd rather not do it now. I'd rather wait until the war in your body right now is over. But once it is, there are various experimental treatments that we can have you undergo. Some of them are quite laborious. Some of them are quite painful. They're all very expensive. But I'm hoping with a few years of physical therapy, we can get that tingling sensation out of your left thumb, and it will behave and feel like a normal thumb again. So this is my solemn vow to you that I will take care of that numbness in your thumb. And again, it won't be an easy road, but we'll get there. So, long day. A long day for you, a long day for me. Really fascinating stuff going on in your body. In a way, this all would have resolved itself with the exception of the numbness in your thumb. So the diagnosis of you being a hypochondriac is, in a way, still accurate. In another way, it's not accurate. But, we can't have everything. And certainly the numbness in your thumb, that is not a result of hypochondria. So I think we've both learned lessons here, and I truly hope, that tonight you'll be able to sleep better. And that's probably the best thing you can do is sleep, to allow these different factions of bacteria and parasites and cancerous cells and cells damaged by radiation and all of those things to come to the conclusion, or come to an armistice, and if not a total victory of one or the other over the other, that will let you be free, and then we can turn our attention to your left thumb. So that's my diagnosis, and I hope you feel better. I know I do. And we'll see you soon for that therapy on your thumb. Don't forget about it. It's gonna be rough, but together we can do it. Okay? All right. Good night.